Welcome back to Phenomenal Health, everybody. I'm Grayson Foster. Joining me today is one of the top dentists practicing in the Little Neck area, and I'm pleased to have with me today Dr. Scott Danoff. Dr. Danoff's specialty is prosthodontics and implant dentistry, and a little later on in the show we'll meet his wife and partner, Dr. Laura Danoff, and she'll be here to discuss Invisalign technology. Dr. Danoff, welcome to the show.
Thank you very much.
Very happy to have you here. All right, you do have sterling credentials and very unique training. Can you give us a little bit of background about your training?
Certainly. I went to the University of Pennsylvania School of Dental Medicine. Following that, I went on to specialize in prosthodontics at Fairleigh Dickinson University.
Okay.
I got a certificate in prosthetics, which is basically I like to do a lot of crown and bridge work and implant work and cosmetic work, and that's right up that line.
Yeah.
I've attended countless continuing education courses. I am a fellow of the International Academy of Dental Facial Aesthetics, and I'm members of the American Dental Association, American Academy of Cosmetic Dentistry, and the American College of Prosthodontics.
Wow, so you have incredible training, incredible credentials. What can a patient expect when they come to see you for a consultation? Well,
there's different reasons people come in for a consult. They can come in just for a general consultation as a new patient. They can come in with pain and have an emergency and they want to have an emergency consultation.
Right.
Or they can come in for a cosmetic consultation. With the cosmetic consultation, the most important part of that is really finding out what the patient really wants so that they can give us their desires and their dreams, where they want their smile to be.
Yeah.
And the more we know about what they really want deep down, the better job we can do in giving them the smile of their dreams.
Can you take a moment to describe your office for us and your facility for the viewers at home?
Well, our office is really, it's based in a house. It's not in a big office building. It's more, we want a more homey environment.
Oh, wow.
The waiting room looks similar to your living room. We want it to be comfortable. In the office in the back, it's all pretty modern and high-tech. My staff, the staff's been with us anywhere between 10 and 20 years. Patients really comment to us about how much they love the staff because they get to know them pretty well.
Wow.
And
so you really treat your patients like family, right?
Well, pretty much.
Yeah.
Actually, one of the things that we talk about a lot when a patient wants to know what treatment we recommend, we will continually tell them that we're diagnosing and treating them as if they were a family member sitting in the chair.
Right. Can you explain exactly what a prosthodontist does and what kind of dental patient comes to see you?
A prosthodontist has an extra specialty training in doing reconstructive work, cosmetic work. We're doing a lot of the accident reconstructions, and a lot of the times we're seeing people and doing the work that is more complex than a regular dentist, a general dentist wants to get involved in.
Right. So if someone has a very complicated case, then you're the guy to come and see, right?
We'd like to think so.
All right. How do you decide whether to crown or veneer your teeth? How do you know what's right for which patient?
Well, a lot of that depends on how much tooth structure is left. Certainly a laminate veneer is the most conservative procedure that we can do now. But if the teeth have a lot of fillings in them, or if there's a large cavity in it, or if they're just severely broken down, then they'll have no choice but to do a crown.
Right.
If they've had a root canal done in the tooth, typically a crown is the better restoration. But we would like to try and keep it as conservative as possible in using just laminates.
How long does that process take from beginning to end, whether you're using a crown or veneer? Is it lengthy or short?
Well, veneer is actually quicker.
Yeah.
Veneers can be done in as quickly as 2 days. The typical veneer case takes a week. Crowns can be rushed to a week, but we're more comfortable giving the lab the time they need to create the right restoration, and generally we'll see people an initial appointment, and then 2 weeks later we'll put their crowns in.
What kind of care and attention do you have to give veneers if you do have them? Do you have to look after them any differently than you do your natural teeth? Are they more prone to staining?
You treat them just like your own teeth.
Yeah.
They are as strong as your natural teeth, and they're as weak as your natural teeth. If you bang your own tooth, the same as you'd bang a veneer, one of them might break.
Right.
Cleaning them is just like your regular teeth. When they're put on and they're put on properly, they should floss like your own teeth, and they should be feeling and working just like they're your own.
Dr. Danoff, do veneers last a lifetime?
Well, veneers could last a lifetime. They could be damaged just like a natural tooth could be damaged, but the long-term studies have showed that the majority of veneers last over 10 years.
Great. All right, we're going to take a look at some befores and afters, so we'll pull those up right now and see some of your fabulous work that you do. Now this is
a case where somebody bleached the lower teeth and wanted to do laminates on the top to match.
Wow. That's beautiful.
This lady had her gums raised up and by laser,
right,
and then crowns made to fit.
Wow, that is a Hollywood smile.
This was actually done by an actor that wanted that big, bright, white smile that they can have on television.
Amazing.
This was a case where somebody had bridge work done on top, and just the lower front teeth were stained. So we wanted to just whiten them up so that everything would kind of match.
Well, that looks fantastic.
This case is basically crown and bridge on the entire mouth. This guy was looking pretty old.
Wow.
And when we got done, he looked an awful lot younger, and he loved it.
Beautiful work.
This was more subtle. This was a young lady that wanted just her two lateral incisors, the teeth on either side of the front teeth, made longer. So what we actually did was we contoured her tissues a little bit on top, and then we brought those two teeth in to match. And the look on her face when she got these was astounding.
That looks fantastic.
Thank you.
Wow.
This one, the patient just wanted to bleach the lower teeth, and then we did veneers on the uppers. Those are just purely laminates on top. Nothing else was done to the teeth.
Those are beautiful.
This person had two teeth remaining. All the rest, except for two eye teeth, all the rest were on removable appliance and wanted implants. So we basically had the surgeon put in implants around the arch, and then ultimately removed the two natural teeth and built a whole bridge on top of the implants.
And how long did that process take?
Takes about 9 months between the implants going in and the restoration.
Wow.
This one just had a one-tooth replacement. You could see on the left side of the screen.
Right.
The person was missing one bicuspid, and so you could see you could just change one tooth and it fits right in naturally.
Okay, so this is replacing two front teeth?
Right, these are the teeth on either side of the two front teeth. I didn't have the before picture, so I showed the implant for x-ray.
Nice.
And you can see on either side of the front teeth there are two implants. And if the surgeon does the right job, you can see that you can't hardly tell, even in a close view, that those are not natural teeth.
Yeah, they look fantastic.
Thank you. This is just a single implant replacing one single front tooth.
Wow. I bet he was happy. Full implants top and bottom there?
Right. Now this is the implant overdentures, which this is an implant overdenture case where implants are placed on the bottom and top, and then dentures are made that fit on top of these implants.
Wow.
This is showing one of those dentures in the implant case. So you see the denture fits like a horseshoe on top.
Right.
That way you're eliminating the palate, which most denture wearers hate because it takes away from their taste sensation, and they can't feel hot and cold on their palate, and this way they get that natural feeling back.
Excellent. I do have to take a break, Dr. Danoff, but when we come back, I'll continue my conversation with Dr. Scott Danoff, and also his wife and partner, Dr. Laura Danoff, will be here to discuss the latest way to straighten your teeth using Invisalign. Stay with us. Phenomenal Health. We'll be right back.